Thank you so much. Good afternoon. It is such a pleasure to be here. It is amazing. Miss McCrary?
Yes, ma'am.
Miss McCrary, that was just a beautiful discussion of the science. I'm actually glad that I'm not here to discuss the science, but I definitely wanted to give a huge shout out because it's science teachers like her that allowed me to become who I am today. So I am a physician. I'm actually a physician here at Grady. We're really close to Grady right now. And I'm a professor of medicine with Morehouse School of Medicine. I was really excited to speak today because I'm going to talk about two of my favorite pastimes lately, which is helping people survive COVID, and then also talking about the healthcare disparities that we're seeing with COVID. The things that I hope to touch about here is one, why teachers indeed should get vaccine priority, some of the health disparities that we're seeing with COVID, and then what can teachers who are currently in the classroom, what they can do to keep themselves safe. So when we talk about why me, I feel like we're currently in this intersection where health is so vitally important. Health and education are really coming together. And with my background and immersion in taking care of COVID patients, I do think I'm uniquely positioned and happy to share my insights. I will say personally, I think for so long and for too long, we've really taken for granted the teachers who've really done such an amazing job shaping the human beings that we are and shaping our little people. Both of my daughters have been on this virtual train since the beginning, and I do have a son who's dyslexic and he's been face to face. So I've been on both sides of the spectrum. I fully celebrate and appreciate all of the teachers who are here, all of the teachers who are watching, who have really shaped the lives of my children and, like I said, myself. I'm also here because I really hope that I can lend my voice to your calls, and if I can give you back, pay you back just a small fraction of what you guys have done for me, that's my goal here. So once again, and I'm sorry, we're doing the slides. Next slide, we're at goals, discussing the importance of prioritizing the vaccine to our teachers, discussing vaccine hesitancy and the disparities, as well as how one can survive COVID if you are unvaccinated and you work in an environment that is not safe. So next slide. Importance of prioritizing the vaccine for the teachers. So let's just really dig into this. I know what it means to be expected to sacrifice. I've chosen to, as a physician who's chosen to devote my career to taking care of the less vulnerable, I know what that means. I know what that looks like. And it's not unexpected. But what I can tell you that when I signed up for this gig, I did not sign up thinking that I would be expected to sacrifice my health and possibly my life. And to many of you teachers out there, even though teaching is a calling, I know you also did not sign up with the expectation that you would be sacrificing your health and your life for your students. And I don't think that's a fair expectation. I will also say, being on the front lines of this pandemic as a hospital medicine physician, I've seen the difficult deaths of people struggling to breathe. I've seen the grief and the tears of families as they lose their loved ones. I've spoken to family members who were so devastated because they couldn't be at their loved one's bedside. And, you know, I feel like I've experienced enough trauma in the past year to need a lifetime of therapy and still not get over it. And the one thing I know is that not one other life should be lost unnecessarily. And especially now that we have the vaccine, it is unconscionable for us to consider sending teachers back to the classroom without allowing them to be vaccinated. And if teachers are the backbone of our society, if there are children's educators, mental health providers, life coaches, and if schools are truly, if we are saying schools are truly essential to the well-being of our children and, let's be honest, our economy, then we need to prioritize the teachers and the people who can make this happen. And I also want to say, if our priorities are truly our children and to get our children back in school, the refusal to include teachers in the priority list for receiving the vaccine shows that either we don't value our children, either we don't value our teachers, or both. And if teachers are to return to the government have to show that they prioritize school reopening. The most important way to do this is by prioritizing the vaccination of our teachers. We vaccinate our teachers to protect them, our community, and our children. The state has a responsibility, they have a duty to provide safe learning environments for our children. Our children go to school to learn, not to contract a potentially deadly virus. And our teachers go to school to teach, not to potentially contract a deadly virus. And we know that we can minimize the spread of COVID-19 through vaccination. Therefore, we must increase the priority of our teachers so that they can receive the vaccine now. So I don't think we can talk about vaccines and COVID without talking about the healthcare disparities. I think we definitely have to consider what this means for our minority teachers and staff. COVID-19 has taken the heaviest toll on our communities of color, the elderly, and those with multiple medical conditions. And our leaders must protect all of our teachers, especially our most vulnerable teachers and staff. The demographic most negatively impacted with returning to school across all ages are our minority teachers. And therefore, when you insist that teachers return to the classroom without providing them with access to the vaccine, we are disproportionately negatively impacting our teachers of color, and we are demonstrating that health equity, social justice, and the lives of our Black and brown teachers and staff are simply not valued. So I also want to just touch briefly on vaccine hesitation. It's not enough to get our teachers higher priority for vaccination if we don't ensure that our teachers of color are willing to get the vaccine once they're eligible. In many communities of color and other marginalized groups, they demonstrate hesitancy when asked whether they will get the vaccine. And it's no surprise that given the history of discrimination and mistreatment by healthcare systems, that many communities of color are hesitant to get the vaccine. And I will say for those teachers and staff who are listening and not quite sure if you're going to get the vaccine, I hear you, I see you, and I understand your hesitancy. If we are being completely honest about this, there are very valid reasons that marginalized communities don't trust the healthcare system. And it's difficult to trust information that's coming from a system that historically has not valued you or those that you love. And I'm not here to convince anyone that that has changed. In fact, the data shows that marginalized populations continue to receive subpar care and have decreased access to quality health care. And so it is actually for that very reason that I encourage minority populations to get the vaccine as soon as it's available, because you cannot be guaranteed that you will have access to quality care if and when you get COVID and become seriously ill. And so one of the most effective ways to protect yourself is by being vaccinated. I also want to say that our school district leaders have a responsibility to prove themselves trustworthy. It is important that they're educating teachers as it relates to vaccine safety and efficacy in a culturally appropriate manner in order to ensure increased vaccine uptake once it becomes available. School districts must take responsibility for the lack of trust and create systems and programs which focus on outreach and education. And so I wanted to briefly share my personal vaccine story. I will say that I understand being hesitant. I was hesitant. You know, I am a physician, but I'm a Black woman first and a physician second. And so initially when the vaccine was available for us, I didn't intend on taking it during the first round. I thought I would just wait about a year or so, wait until the kinks had been worked out. You know, I survived this long, I could continue to do so. But that was a fear-based response and not a science-based response. And I will tell you, when I looked at the science and the data behind the vaccine, efficacy and the safety, the evidence was overwhelmingly in support of getting the vaccine. It is a safe vaccine, it is an effective vaccine. And honestly, at the end of the day, there was nothing to support me not getting the vaccine except my fear and mistrust of the system. I will also say, given my role as a physician, I know better than most that the reality of COVID is much more serious than any imaginary fears I had about the vaccine. I knew that I needed to get the vaccine to not only protect myself, but to protect my children, my husband, and my patients. And ultimately, getting the COVID vaccine was not just for me, it was for those around me who could not yet be vaccinated. And so I received both doses of the Pfizer vaccine about 2 months ago. I didn't have any significant side effects. I actually just had a headache and a really sore arm for about a day. I can tell you that it really feels liberating to have gotten the vaccine. I love to take my mask off, but I feel like I need to, show like proper masking even in spite of the vaccine, but it really has been liberating. And I will also tell you that my story is not unique within the Black scientific community. There are many of us who have had doubts. There are many of us who have had fears and concerns. And I think it's really, really important that Black doctors and healthcare providers be given a platform so that people within the community will know that their fears are understandable and so that those concerns can be addressed. So that's why I said yes to the vaccine. And the reasons why you should say yes to the vaccine is it's safe, it's effective, it prevents severe illness and death, and honestly, it is much, much better than getting COVID. Now, so the other thing is, so my next slide, I talk about the school district responsibility for addressing healthcare disparities. And I guess the question is the school district responsible? And I think they are. When you consider that Black people have a much higher death rate and higher severity of illness with COVID, the fact that school districts and leaders have opened schools without prioritizing teacher vaccination demonstrates at best a lack of awareness of the fact that this disease is killing Black folks at a much higher rate, or at worst, it demonstrates a lack of concern. This is an example of the systemic disenfranchisement and marginalization of vulnerable groups who are at highest risk of death from COVID, and thus bear the highest burden of illness and risk when they return to schools in unsafe environments. And when you make a decision to open schools without teacher priority for vaccination and without taking into consideration the risk of death for those who you are responsible for, then you are part of the problem. And I challenge the school district leaders, our representatives, and our governors to be a part of the solution. So, what do we do in the meantime? I know that there are teachers watching this who are saying, well, I'm already in the schools. What do we do for those teachers who are already in the school system, they're going to school on Monday, and they're not necessarily in the safest environments? So my next slide touches on what is the appropriate mitigation? And I think we all know. Mask, eye protection, HVAC, physical distancing, hand hygiene, cleaning and disinfection, and cohorting. So what happens if you are in a school where maybe they do 1 out of the 8? Maybe they do half of them. And you're just so I really want to speak to that anxiety that some teachers have, because some teachers are in less ideal environments and in under-resourced schools. So I will tell you, as a hospital medicine doctor, who's been on the front line since day one, I know the fear, I know the anxiety, and I know what it feels like to be in a place where initially we didn't know how COVID was transmitted, we didn't know the best way to protect ourselves. There was a lot of guessing and a lot of things that were happening initially, and we're not in that place now. That was then, this is now, and now we know a great deal about what you can do to keep yourself safe. And I will tell you, for myself as somebody who, I feel like I swim in COVID on a daily basis, I've managed to keep myself safe for 10 months without a vaccine, with doing really simple things. And those simple things are things that you can do as teachers, even if your school system is not doing the things that they should be doing. And first and foremost, masking. Masking is the most important thing that you can do. I wear a N95 that's been appropriately fitted, but you can also wear a KN95. They've been shown to be, I will say, equally as effective. And then I also wear a surgical mask over my N95. And if I were a teacher, I would definitely double mask. I would wear the KN95, and then I would wear a mask over the KN95, either a surgical mask or a cloth mask. So double masking at all times. I would also wear eye protection. So whether you wear the face shield, as our first presenter did, or whether you're wearing like the safety goggles, you wear those to protect yourself, because I don't know that the CDC recommends it, but when I did mitigation strategies for our school district, it's something that we encourage because there are people who are going to have COVID and it'll help keep you safer. Also, hand sanitizer. The beautiful, beautiful thing about this virus, if there's anything beautiful about it, is that it can easily be killed and destroyed. And so hand washing, 20 seconds or more, it works. Hand sanitizer, it works. And so I want people to walk away and to know proper masking, eye protection, and hand sanitizing, keeping your hands clean can keep you safe. It really can. And then physical distancing, just staying as far away from people as you can. So on my next slide, I talk about the top 10 ways to avoid COVID-19 in the school system. Number one, always assume that someone in your group has COVID, because they do, and act accordingly. Number two, never remove your mask around others indoors, because COVID. And what does that mean for a teacher? This means you don't eat indoors. You don't eat where there are other people. I know for myself, working in a hospital, when my office was moved out of the hospital to another building, I couldn't go to my office to eat. And so I would go outside to eat, I would go to my car and eat, or I actually wouldn't eat. Not the best practice, but there was just no way I was taking my mask off inside of a building where I knew that there was somebody there who had COVID. Number three, know that you are more likely to get COVID from your colleagues than your students. So I know that there are teachers who are afraid of their students, there's parents who are afraid that their kids are going to get COVID from their teachers. And the reality, when you look at a lot of these studies, there's minimum transmission between teachers and students and teachers. You're just much more likely to get COVID from your colleagues. And the primary reason for this is because who are you going to take your mask down around? Who are you going to sit down and eat lunch with? Who are you going to let your guard down with because, well, that's my best friend, she doesn't have COVID. And those are the people who are that's how you're going to get infected. And so I want to remind you that you want to stay as safe as possible in the building with your colleagues. And that means not taking your mask down at all when you're in school. Number four, apply hand sanitizer at least 100 times a day. I'm kidding, sorta. It feels like 100 times a day, but I promise you, I use hand sanitizer numerous times. If I touch and readjust my mask, I'm using hand sanitizer. My eye can itch, I don't touch my eye, which can help you to remember not to touch your eye if you have on face protection. And so if your eye itches, you let it itch. So using hand sanitizer, and if you're using hand sanitizer and you try to scratch your eye, it's going to burn. So once again, hand sanitizer is a beautiful thing. Number five, no matter how cute the kid, don't hug them, or don't hug him or her. And the reason I include that is because social norms are social norms, and that is one thing that you will just have to really remember. That is just not something I can do because COVID is a highly transmissible infectious disease. And number six, maintain physical distancing whenever possible. Number seven, double mask. Number eight, wear your eye protection. Number nine, never let your guard down. And number 10, get vaccinated when you are eligible. And remember, layered protection is the key. And so even as you wait for your eligibility to get vaccinated, remember, there are just so many things that you can do to keep yourself safe. So what are the next steps? We all should be advocating for teachers to get priority for vaccines. Whether you are a teacher, a parent, a small business owner, we are all vested in getting our teachers back in school and our teachers being safe. Get vaccinated when you are eligible. Next step, also continue to advocate for appropriate mitigations in all the schools. There are schools that are not doing the mitigation strategies that they can do, and we need to really be advocating that they do them. There's honestly no reason this far in the pandemic that we don't have certain basic measures in place. And lastly, district leaders should actively engage with teachers and staff of color to address vaccine hesitancy and encourage vaccine uptake. And so, just putting everything together, I'm here because I believe that our teachers matter, I believe that our students matter, and prioritizing teachers to get the vaccine needs to be done immediately. If teachers are teaching within the classrooms, then they should be receiving the vaccine. It's really that simple. And let's demonstrate that we value our teachers and our children by protecting and advocating for the very individuals who sacrifice so much to ensure that our children are safe and taken care of and educated. We are all in this together. And so when I was putting this together, I want to do teacher shout outs. And I put together a list of all the teachers who have meant so much to my family and my children throughout the years. I will say that I have 3 kids, but their ages, like I said, kindergarten, 2nd grade, 5th grade, and I have at least 30 teachers on this list. And so in even just a short period of time, I'm like, oh my God, there have been so many people who've been so impactful to us. Mr. Luke, Miss Keisha, Miss Parks, Miss March, Miss Edwards, Miss Long, Miss Fiber, Miss Cannon, Miss Nicholson, Mr. Finn, Miss Anissa, Miss Blackman, Miss Daniels, Miss Gabrielle, Miss Fowler, Miss Matthews Davis, Miss Cock, Miss Ash, Miss Wanda, Miss Kayla, Miss Kelly, Miss Mary Grace, Miss Pitts, Miss Ebony, Miss Janelle, Miss Ruth, Miss Block, Miss Frederick, Miss Embry, and Miss Noggle. Thank you for the opportunity to share with you all. If there are any questions, I'm happy to, if you put those in the chat. And then you can also reach me at mwsims@msm.edu. Thank you.
Thank you so much.